everyone, and welcome to this webinar hosted by the American Academy of Yoga. Namaste, everyone, and welcome to this webinar hosted by the American Academy of Yoga and Meditation. My name is Shri, and I'll be your host today. For our new viewers who are joining us for the first time, I would like to take this opportunity to introduce you to the American Academy of Yoga and Meditation. AAYM is a non-profit organization which is dedicated to education and research in the field of yoga and meditation and promoting and spreading the philosophies of holistic healing. Through this webinar series, we hope to spread the amazing benefits that yoga and meditation have to people around the world. The topic for today's webinar is Yoga for Neuro Rehab after Stroke. Each year, 15 million people suffer from stroke, and 1/3 of them die from it. A stroke occurs when part of the brain stops getting the steady supply of oxygen-rich blood. This can happen because of a blockage or breakage in a vessel supplying blood to the brain. Either of these events can cause major damage to fragile brain tissues. A stroke can cause complications with speech, memory, and movements of the arms and legs. And many times, people suffer serious long-term disabilities because of this. Today, we will learn how yoga can help in the neuro rehab after a stroke with some expert speakers. One of our first speaker today is Ms. Christine Weber. Ms. Weber, who is a certified yoga therapist and the director of the Subtle Yoga Teacher Training Program in North Carolina. She also presents workshops and training internationally. Welcome, Ms. Weber. Our next speaker is Dr. Padmini, who is a neurologist currently involved in clinical research of neural effects. She is a heartfulness meditation practitioner and trainer for 36 years. Welcome, Dr. Padmini.
Great.
Our final speaker is Dr. Amit Singh. Dr. Amit Singh, who is the Integrative Medicine Consultant and Chief Medical Officer at the Arogyadam Hospital of S. Vyasa University. Thank you so much for coming, Dr. Amitji. It is now my honor to introduce you all our moderator, Dr. Hemant Bhargav. Dr. Bhargav got a PhD in yoga and he is a medical practitioner focused on community mental health and yoga. He is the assistant professor at the Department of Integrative Medicine at NIMHANS, and he has written 71 research publications. He has also written 2 books and 8 book chapters. He has been the recipient of 4 grants and he is also member of the Society for Neuroscience in the US. I hope you all enjoy this webinar. Once again, thank you all for joining us today. And I will now pass it on to Dr. Bhargav to introduce our speakers. Thank you and welcome.
Thank you very much, Sri. I once again welcome the audience here for this very interesting webinar focusing on the concept of neuro rehab and what yoga and meditation can play in this particular issue. We have with us very esteemed guest today coming from different backgrounds. Dr. Rangaswamy Padmini, who comes from the background of neurology, is a retired neurologist from California, USA, and she's also a heartfulness meditation practitioner for over 44 years. In fact, her journey into exploring the dimensions of yoga and meditation started with Raj Yoga meditation practice, and then she got into heartfulness meditation, and for 36 years she's not only a practitioner but also a trainer for heartfulness meditation. She did her medical degree from Maulana Azad Medical College in New Delhi, and after that she did her post graduation in internal medicine. Subsequently, she was working into the Department of Neurology at Safdarganj Hospital in New Delhi. She has extensive clinical experience pertaining to the field of neurology and neuro rehab and has published several papers in peer-reviewed international journals. I once again welcome Dr. Rangaswamy Padmini. We also have with us Christine Weber. She is a trained certified yoga therapist and the director of Subtle Yoga Teacher Training for Behavioral Health Professional Program in North Carolina. She has an extensive experience of more than 30 years of dealing with patients who suffer from different neurological issues, and she has been teaching since the year 1995. The specialty of Dr. Christine is patient empowerment. We see that through hands-on training to the patient, she had been able to transform the lives of many patients, and she will be giving us a lot of wonderful insights onto the nuances of yoga therapy and the mind of the patient who suffer from such catastrophic events in their life. Also, we have another esteemed guest, Dr. Amit Singh, Associate Professor in the Division of Yoga and Life Sciences at Swami Vivekananda Yoga University, Bangalore. He has been working as the Integrative Medical Consultant in the Vyasa Integrative Center, Bangalore, and is also a visiting faculty for the Vayu University in USA. Dr. Amit Singh has a unique combination. He is basically a Ayurveda graduate with a MD and PhD in the field of yoga therapy. Dr. Amit Singh specializes in integration of different disciplines, modern with Ayurveda and yoga, in the Holistic Healthcare Center at Vyasa, Bangalore. He has been heading the center, a 350-bedded medical hospital which has a separate division of neurology. I welcome Dr. Amit Singh once again. Now, as we begin the flow of events, first of all, I would like to invite speakers one by one for their opening remarks. Now, these opening remarks can focus on stroke, concept of neuro rehab, and in their own understanding, their own clinical understanding, how we can understand neuro rehab and then the role that can be played by yoga and meditation in this dimension. I would like to begin with Dr. Padmini.
Thank you. Thank you, Dr. Hemant Bhargavji. I would like to start with thanking Dr. Indranil Basure of the Academy of Yoga and Meditation for the invitation to speak at the global platform of the International Yoga Conference USA 2021. It is indeed an honor and a privilege. Thank you, Sriji and Dr. Hemant Bhargavji, for your generous introduction. I look forward to learning from this esteemed panel of speakers. I'll be remiss if I did not acknowledge the very professional back-end staff working tirelessly to put together an enormous project like this. I'm indeed grateful to the audience from different parts of the globe assembled virtually and hope to learn from all of you and share my own experience. Let's start with just a second. Okay, so let's start with what neuro rehab is about in stroke. As you all know, it's caused by either a thrombotic, embolic, or a hemorrhagic event, and the symptoms are based on the location of the loss of blood supply that creates different symptoms, and depending on what the symptoms are, the treatment is tailored to their needs. The word rehabilitation is derived from Latin, rehabitare, means again, make it fit again, is the exact meaning. So I would like to start with the understanding that because of my background and training in neurology across continents, uh, and also my background in meditation and training uh, in meditation, I like the idea of having an integrated approach to treatment. One has to become a bridge between different approaches to treatment. I have had the privilege of learning neurology across continents since 1972, both in New Delhi, India, and at the Stanford University in California. So it helped me to understand the wealth of knowledge available both in modern medicine and in the multiple systems of traditional medicine practiced over many millennia in the world. Professor Baldev Singh from the All India Institute of Medical Sciences was one of the first people that intrigued my understanding back in 1961 when he published about the EEG effects on yoga, on yogis. And one can imagine he had the foresight to try and understand it from both disciplines. Again, I had the privilege of being trained by Dr. Gauri Devi, who mentored me, and she interacted with Dr. B.S. Venkatram, who is a Ayurvedic medicine researcher, and they published together in the Neurology Society of India conference in 1976 on how Charaka Samhita talks about muscular dystrophy and how it is transmitted. And so we realized that there is a lot to learn from each other. I myself worked with Dr. Bhattacharya, an anesthesiologist who learned acupuncture in mainland China And I myself have dabbled in treatment of acupuncture, treatment with acupuncture in Parkinson's disease. Unfortunately, I had to leave the country, so I kind of couldn't continue the project. My training in heartfulness practice of Raja Yoga helped me to understand the need to regulate the mind by meditation and develop a balanced approach to well-being. So, what do we do in neuro rehab? In the acute phase, we have to understand rehab is always a collaborative effort involving multiple disciplines. In allopathic medicine, it starts from the time of diagnosis. We start right from positioning the patient, physiotherapy with passive range of movement, occupational therapy, nutritional support, psychological support, social and family support. So all these things are necessary right from the acute phase. And when you go on to the long term, we realize that because of neuronal plasticity, recovery is possible over a protracted period of time. So that gives a lot of hope to the patient who in the beginning would be shell shocked because he wouldn't know what his outcome is going to be. So this is a very uh, involved way of approaching the patient care. So there is progressive increase in activity. You get again the various therapists involved, including the psychologist, the social service, nutrition, speech, occupational therapy, and various supportive devices are given to the patient depending on what is their specific need, such as, if you need a particular type of locomotive device, then you try to incorporate in the treatment. So in a very uh, clear way, one has to understand that it is always individualized. It is not something that you can give as a blanket treatment. There is everything has to be tailored to the needs of the particular patient whose limitations may be different.
Thank you, Dr. Padmini, for giving us a wonderful overview, multiple dimension of the neuro rehab, and also pointing out where is the role for yoga and meditation into it. Now, I would like to switch to Christine. Christine, in your patient care, where did you find the role of yoga in neuro rehab?
So I started working in a nursing home hospice facility in 1995 in Pennsylvania. It was run by Quakers, and if you know anything about Quakers, they're kind of like the Buddhists of the West. There were two. I want to tell you about two of the women that I worked with who both had strokes. One was named Mary, the other was Diana, and they lived in this nursing home. And they were great friends, and they both had cognitive symptoms, cognitive challenges because of their strokes. And they came religiously to my yoga therapy group, which was just a small group. Most of the women in the group had strokes. Diana was in a wheelchair. Actually, Mary was in a wheelchair too. Some of the people were using walkers, so some were not in wheelchairs. And Diana's stroke had affected the left side of her body so badly that we had to put a washcloth in her hand because of the contracture and how the fingernails would cut into her hand. That's how much issues she had. So we did a lot of abhyanga. I taught her self-massage, and we started to work on opening the hand a little bit. And the other thing that we did a lot was visualization. Like, imagine that you're moving this hand. And we did a lot of bilateral stimulation and contralateral stimulation to try to get the hemispheres of the brain to connect a little bit better. Now, Mary had a few more cognitive challenges than Diana, and she had a lot of digestive issues. But she had use of both hands. The side that was affected, I can't remember if it was right or left side, but she didn't have a complete lack of use of the side of her body. And so they both came to my classes religiously for about my sessions and my group therapy sessions religiously for, it was about 3 years. And Mary passed away while I was there. Diana was still very functional and she worked very hard on her attitude although depression, she told me depression was an issue for her. What that experience for me when I was a young person working in the field of yoga therapy before yoga therapy was even defined in the United States was it really impressed upon me the way that yoga practice can help people to feel like they have some power over their situation, because one of the first things that happens when you have a catastrophic event like a stroke is that you feel a lack of power. You feel a sense of you have this sense of lack of agency and the health locus of control. Your locus of control has been taken away from you. So when you can offer very simple practices, whether it's self-massage, whether it's some simple movement, I would see a lot of joy in working with Mary and Diana. And I wanted to share them with you because I think that when we look at from the patient's experience, or the client, in my case, I call them my client's experience, it helps us to develop a sense of empathy, and empathy is key in any kind of, if we're going to make any kind of progress. I think one of the things I think that's so important is that we are using the senses and the motor organs to affect a shift in the brain, right? So we're trying to not just use the sensory motor organs, not just fix the brain, but fix the whole self. And I can't help but be reminded of the story from the Upanishads of the chariot and the horses and the reins, so the horses are the panchendriyas, they're going out and they're looking, they're the senses going out and looking for everything. Sometimes that's called the jnanendriyas. And the reins are, like the mind, but somebody has to hold the reins. So the buddhi, the intellect, holds these reins, and the atman sits behind. So when you think about the reins and you think about the horses, then the body, of course, is the chariot. You think about this whole structure of what a human being is. If we hyper focus only on the brain, we miss all the aspects of what it means to be human, and a higher knowledge or a higher intelligence that human beings possess that is very important to include in the healing process, I think. So when I talk about empathy from the practitioner, when I talk about the sense of trying to understand the lack of empowerment, I think also the other piece that's so key here is to understand what we are as human beings, and that there's so much potential for healing that maybe goes beyond what our scientific understanding can relate to us. And that's really where the healing possibility is there. Of course, we have to understand the science when it comes to something like as difficult and challenging as stroke rehab, but what yoga can offer is something very powerful, I think, to folks who are struggling. So thank you.
Christine, really very insightful thoughts, especially the example from the Kathopanishad, which really summarizes how yoga looks at a human being and how the hierarchy of systems are there in the body which should be utilized. So thank you very much. And Christine here emphasized the role of patient empowerment in stroke. We know that there is no other illness which disables a patient like stroke in such a short duration of time, and then therefore the self-empowerment that can come to patient through yoga and meditation really is very powerful. Now we go to our next speaker, Dr. Amit Singh. Dr. Amit Singh, please enlighten us in your view, what role yoga can play in neuro rehab?
Thank you, Dr. Heman. Actually, yoga is playing very important role in the neurorehabilitation because the understanding of yoga therapy or yogic concept, it's not limited at a physical level. So it's at a physical level, at a mental level, at a pranic level, intellectual level, and blissful body level. Because as mentioned in the Taittiriya Upanishad, the whole body is made up of 5 kosas, 5 sheaths. So for each and every kosas, suppose for the Annamaya kosha, we are giving the Sukshmayam and Asana. For the Pranamaya kosha, Pranayama. For the Manomaya kosha, meditation. And for the Vigyanmaya kosha, counseling, lecture, understanding about the element is very important to build the confidence for the participant is very important. When we are having our setup in Arogya Dhama, 350 bed hospital, when we are getting a neuro rehab patient, so we have the group consultation with modern medical consultant, Ayurveda, yoga, naturopathy, physiotherapy, and acupuncture. And we make one integrative program, tailor-made program, individualized, personalized program for each and every patient. And our dean, Dr. Nagratna, she focused more on their emotional part. She explained to us first we should see the emotions of the patient. What is the cause of this? Suppose if you go for the cause of this stroke, what is the cause of the stroke? What are the risk factor for the stroke? Hypertension is the major risk factor for the this stroke, maybe ischemic or hemorrhagic. So what is behind the hypertension? What is their mind? What is their emotions? What are the stress factor which increases the cortisol level, which increases their pulse rate, which increases blood pressure? What is stress which causes the peripheral vasoconstriction, increases the blood pressure? Please work on their emotions, talk to them. Because even though they are the stroke patients now, but they are suffering from the hypertension, diabetes still. So when we are working from the integrated approach of yoga therapy concept, we are working on the whole system. We are bringing systemic homeostasis through the yoga therapy. We are reducing the systemic inflammation from the body. Even though we are telling them because they are not able to do the Nadi Shodhan Pranayam or Anulom Vilom Pranayam. In the initial stage, we told to the participant, please focus on the breath. Breath awareness is important. After the awareness, when they are aware of the tip of the nose, so they can balance the sympathetic and parasympathetic. After the awareness, slowness of the breath is important. This awareness and slowness of breath, how it works. Sometimes if you not explain to the participants, so they will not focus on that. We told them this breath awareness and slowness work on your body also, work on your brain also. How in the brain? It work on the mechanism of the mind. It converts your reaction into the response. It converts your sensitivity into the sensibility. It converts your alertness of the mind. Too much speed of the mind. It converts into the awareness of. And when it comes to the body part, muscles, it works on the mechanics of the muscles. Where there is a resistance, there is a rigidity, it converts into the relaxation. So we bring their awareness to the body, we synchronize the brain, breath, body together and works at each and every kosas. In the same way, we are working for the Ayurvedic part also, naturopathy also, acupuncture also, and physiotherapy.
Thank you very much, Dr. Amit Singh, providing a very holistic view of looking at stroke from the yogic perspective, the 5 layer model, and then various dimensions of how different practices of yoga work at those layers. So really, the discussion has opened up very interestingly now. I would like to go again to Dr. Padmini. Dr. Padmini, as we see that neuro rehab is just not a simple event. Patient has complex problems. There is not only weakness of the body, there is involvement of the cognition, there is involvement of the bowel bladder functions, and we see that it is a multidisciplinary approach. There is a definite importance of controlling their blood pressure, controlling their sugar levels, and the pharmacological approaches, the medications also play an important role, along with the role played by, of course, yoga, occupational therapists, physiotherapists. So I would like to ask you, Dr. Padmini, about how this multidisciplinary approach can be harmonized and brought in sync with each other to provide a best patient care.
That is a wonderful question, and very close to my heart as well. In fact, the the way to look at it is once a person has a stroke, you need a village to make them get back to their normal state. It really is true. We cannot we cannot ignore every little help that they can get from every corner of their existence. As mentioned by the other speakers as well, I think it's important to recognize that we have to individualize therapy. What do you do to a patient who is in a village, who doesn't have access to all these things that we are talking about? So we need to optimize availability of resources and find a, a harmonious way of delivering hope and improvement to the patient. But let's leave this aside. I think by the time somebody has a stroke, we've already done a lot of damage. The more important thing is to prevent strokes from happening. What can we do? Because just think of the prohibitive cost to individuals and societies. Just the cost alone can wipe out societies. If we have to give what is considered standard of care in the United States, there will be no money left to eat. So we need to recognize that this is not possible universally. So that is why I think it's very important to include other avenues of treatment which are less impactful in terms of economics, and also give them certain level of independence. Like Dr. Christine said, you can do yoga at home. You don't need 100 people to be around you to do your yoga as long as you learn it properly in the first time around. And somebody can just supervise you online or whichever way there is. I mean, we've all become experts at online services nowadays. Look at us; we're having a conference online. So this is an enormous opportunity to use our resources in a most efficient and sensible way. And of course, the community and the family of caregivers have to be taken care of too. It is not easy for the caregiver to continuously be associated with one person who's so disabled. So we need to recognize the value of the impact of stroke and try to stop it from happening rather than wait for it to happen. Of course, you have to treat the people who already had the stroke. So it has a major psychological, social, and mental impact. And so we need to recognize the importance of underlying treatment of underlying metabolic illnesses like diabetes, hypertension, all those other good stuff. Healthy lifestyle changes to prevent these disorders from happening. Understanding the correct attitude to wellness is also important. Somewhere or the other, we'll all get sick. How do we approach sickness and wellness? How do we incorporate that resilience in ourselves to deal with what we have on our plate? This is a very important thing. And this is where I think developing a healthy mind is a very important aspect of care at all levels. So, how do we regulate the mind? We all know the power of thought. Everything that we do originates before action in a thought, and thoughts originate in the mind. So, mind has a tremendous influence on the body. The mind body medicine is a well recognized entity. So, a properly regulated mind alone can result in optimal outcomes. So, meditation is the way to regulate the mind. There is a vibrational field beyond mind where entire manifestation originates. So Raja Yoga, meaning the king of yogas, is the science of the mind codified by the sage Patanjali long time ago. My training in Heartfulness Raja Yoga helped me to understand the importance of regulating the mind by meditation in a very practical, experiential way. When we experience personally by systematic meditation practice and observation, we realize that meditation changes us practically and conviction develops in our ability to make changes in ourselves and in others. So I call that alone science, where no matter who does it, there is reproducibility of results. So to conclude, we go back to the idea of rehabilitar or to make fit again. In line with the dictum, fitness is well-being of the physical, mental, emotional, and spiritual well-being. This is reflected in Sage Patanjali's Ashtanga Yoga, which is a comprehensive approach to human well-being. So yama, niyama, asana, pranayama, pratyahara, dhyana, dharana, samadhi. So these are the steps, but all these happen simultaneously. You don't have to wait to go through yoga and then go to, go through asana and then go to the other thing. They can all be simultaneous. And this is one of the beauties of the practice that I help people learn. And I just thought, for those of you who have an interest in this area, there is a very nice magazine that is published by the Heartfulness Institute called the Heartfulness Magazine. And please look up the December 2019 collector's edition, where there is a very comprehensive understanding of yogic psychology based on our ancient system of yoga and yogic practices. Thank you so much.
Thank you very much, Dr. Padmini. Dr. Padmini very importantly brought out the importance of mind-body medicine being a cost-effective approach which can empower the patient. It deserves much more support from the administrators in countries like USA, where affording such treatments is quite costly. So therefore, I think it was a very important comment, Dr. Padmini. Now, I would like to ask Christine. Christine, you have been dealing with patients suffering from stroke, Parkinson's disease. So, in your experience, the involvement of physiotherapists, occupational therapists with yoga, how did it integrate?
How does it integrate? It's a really good question. And Dr. Padmini, I just love listening to you talk. So thank you so much. You have so much wisdom, and it's really inspiring to hear you speak. So to get to the question, how do you integrate yoga therapy with OT, with PT? How do you make sure that you're not coming in and threatening and saying, oh, I can do OT or I can do PT? Because a lot of yoga therapy looks like PT and it looks like OT. And the last thing I want to do is when I'm working on it with an integrative team is make anybody feel like they're redundant or like I'm trying to do the job better than they are. We have to think about yoga therapy as part of an integrative, and I would also say integrated, because in America, the term integrated care means when you integrate mental health with primary care. I think of yoga therapy as being part. Now, what is the distinction of yoga therapy? I think that's an important question. And I think that when we say what could yoga therapy do that maybe is a little different, for me, I was trained in Desikachar yoga, Vini yoga, from the great teacher from South India, and the practice of understanding how to work very subtly with the breath, I think, is something that yoga therapists can offer. There's many teachers of breath work in the United States. For example, Andrew Weil will tell everybody, do a 4-7-8 ratio breath, or many of the mental health practitioners teach something they call square breath, which means, inhale 4, pause 4, exhale 4, pause 4. They teach these sorts of things. And then there's so many people teaching about mindfulness and so many people teaching about meditation, and then many, many asana teachers. So you have all these things and they're kind of reductive, which makes sense because Western medicine is very reductive, right? Reductionistic, if you like. What yoga therapy can do, first of all, is it teaches the practitioner that there's a parallel process. You, as a practitioner, are doing the work, right? So you understand how the breath works. And if you're working with your breath over time, over 1 year, over 5 years, over 10, over a lifetime, perhaps you have some insight to the breath that's a little different than someone who says, here's this golden ratio, because there is no golden ratio. As Dr. Padmini was saying, care has to very much be individualized in every kind of disease process, right? So What a yoga therapist could do is spend a little bit more time, perhaps, especially because we don't have licensure, so we don't have to worry in the same extent about reimbursement. So working a little bit more individualized and helping people learn how to do breathing practices or movement practices that can be special for them and aren't just following a protocol. So that's one thing. And that being said, I think the cost effectiveness of yoga therapy can translate when we work with small groups. So I talked about Mary and Diana. There were about, I don't know, 3 to 5 people in that group regularly. So that's actually quite cost effective when you're working with somebody. And then you're also helping, the other big piece that I don't want to leave out, and you see this in occupational therapy as well, but the other big piece, of course, is leveraging spiritual assets. So helping somebody to operationalize their spirituality and use it in the healing process, I think, is a very important part of the yoga therapy. So we have some tools that may be slightly different than the physical therapist, than the occupational therapist, and the in the United States, the issue of it's a very problematic issue in terms of reimbursement. That's a big issue. So if we can work a little bit on the outside of the system, that sometimes is one way that we can help. And then, of course, my big piece here is patient self-management, internalizing the locus of control, and giving patients, giving clients some tools that they can take away with them. And feel good about the work that they're doing for themselves. So I think that those are some things that maybe don't separate, but maybe yoga therapy is complementary, I would suggest. And then just one more thing to follow up on what Dr. Padmini was talking about is that I truly believe that yoga, not yoga chikitsa necessarily, but yoga practice itself, is perhaps the best preventative medicine that there is on the planet. To adopt a yogic lifestyle, to commit and develop a habit of regular daily meditation, asana, pranayama practice, I think is one of the best things that human beings can do. And it's very low cost. It's very powerful, and it's empowering as well. So I think there's so many aspects of how yoga can be part of the system in terms of therapy, but also in terms of health promotion and prevention, for sure.
Christine, very insightful thoughts. Yoga therapy, how it can be integrated with physiotherapy, occupational therapy. The strength of yoga, as pointed out by Christine, is managing the breath, managing the mind, managing the self-management, the self-transformation that can happen. And then the other dimension, very vital dimension, is the use of yogic lifestyle in not only reducing the risk factors through primary prevention, but secondary and tertiary prevention is very important. Thank you very much, Christine. Now, when we are looking towards a yogic way of living and utilizing different yoga tools in patients, I think there is no better person than Dr. Amit Singh, who has been managing a integrated yoga, Ayurveda, modern medicine, naturopathy, acupuncture kind of a setup in Bangalore, a inpatient residential setup for patients. So, Dr. Amit Singh, kindly highlight us on what kind of yogic lifestyle can be followed by a patient from morning to evening, that is actually done at your institute for prevention of stroke, and then what kind of particular tools may be helpful in addressing particular problems in stroke, such as stiffness, bowel bladder issues, cognitive issues.
Thank you, Dr. Hemanji. Actually, as I explained, our approach is overall approach at each kosas. So if you come to the disease, Vyadhi, so in the yogic text, they consider stroke as a adhija. Means it is a non-communicable disease, a stress-borne disease, mind-body disease. So here the importance of mind is very important. Role of mind is very important. Emotion is very important. So whatever the practice we are doing, we are not focused at a physical level. We are going to the pranic level, emotional level, intellectual level, at the level of blissful body. So sometimes participants they ask the question, Doctor, how you are telling this physical body is different from the manomaya body, mind body, then pranic body, then intellectual body? So just I'm sharing one example. We give example to the patient because understanding of the disease is very important for them. We told this is the mobile, this is the physical body. If it is not charged, so there is a no prana, there is a no use of it. And if it's charged also, if there is a no SIM card, so that is the manomaya kosha, your mind, there is a no use of it. Even though there is a mobile, there is a charging, there is a SIM card, if there is a no network, so what is the use of this? So in the same way, our this whole body is made up of these five layers. Same thing mentioned in the Ayurvedic text also. Sam dosha, sham agni, sham dhatu malakriya, prasanna atma indriya manaswasthitya vidhiyate. Means they also emphasize the role of mind, happiness of the mind, indriya and soul along with this physical health. So now your next question, how it works, what is the role of yoga therapy, what is our daily schedule? We are giving them the loosening practices, asanas. So during the loosening practices, sometimes patients they are not aware of it. So our aim and objective, this physical movement creates awareness to the internal and deeper tissues and organs. So this is the way how we are going from gross to subtle, from known to unknown, or we can say that yoga asana is a mastery over involuntary nervous system through the voluntary nervous system. How through this physical movement we are going at a deeper level, we are stimulating to the target organ, flow of prana, we are improving the flow of prana, blood circulation to reach that level and give a deeper relaxation which helps in the rejuvenation and reduces the resistance. We have the several publication yoga, this physical postures, it reduces the peripheral vascular resistance. If it reduces, if we are giving the relaxation at the muscular level, same time we are giving at a vascular level, at a cellular level. So what Christine has said about the visualization. So visualization helps a lot to go to the depth of it. And if you ask about the stroke, what is our understanding? What is the yogic and Ayurveda understanding about the stroke? So we are seeing the personality like Vata, Pitta, and Kapha. So what we found, what is our experience? There is a two type of stroke, mainly hemorrhagic and ischemic. But Vayu is the root cause of it as per the Ayurvedic text. Vata is the predominant in this. So in the ischemic, we found there is a predominance of kapha, and in the hemorrhagic, there is a predominance of pitta. So who is Vata and Kapha personality? They are more prone for the ischemic. Who is the Vata and Pitta personality? They are more prone for the hemorrhagic. So this is at the level of mind. Sattva, Rajas, and Tamas from the yogic text. If you come to the pranic concept, where we have the vitiation of prana like ajivnatvam, atijivnatvam, kujivnatvam. So we are fine where vata and kapha, where there is a ischemic, there is a ajivnatvam, there is a low prana. Where we are having the vata and pitta, where we are having atijivnatvam, high prana, which we can compare with the pitta here, that side kapha. In the tamo, in gunas, that is the rajas guna, hemorrhagic, and this is the tamoguna. So understanding their personality, taking the parameter of vata, pitta, kapha, and make the yoga protocol, their diet protocol, their counseling, everything. Behalf of that is gives the better result to each and every participants. Even though in the Ayurveda, as per their Prakriti, we have the major treatment. We start with the Sirodhara, we start the Nasya, we give them Abhyangam, we are giving them Shvedam therapy. and we are giving them basti. Basti is a very important treatment in the stroke. Why? Because vata is the root of this disease. And what is the root? Where is vata in the body? So pakvase kati sakthi srotasthi spashendriyam pakvadhanam vatasya vishesta. So vata is situated in the pakvasha, means in the large intestine. The root of vata in the large intestine. And in the ancient text, in the Ayurveda, they mention the Panchakarma therapy. Among the Panchakarma, Basti is the best treatment to pacify the vata. Like emesis therapy, Basti is the enema therapy. Like emesis therapy, Virechana for the pitta, Vamana, vomiting therapy for the kapha, vitiation of kapha. If there is a vitiation of vata, so we have planned the Basti enema treatment. Even though in the enema, two type of enema. In the text, it's the Sthapana and Vasan. Here we can talk. One is the Kashaya enema, water enema, and one is the oil enema. So here we are giving them oil enema because oil, among the Chatusneham, Sarpi, Majja, Vasa, Tailam, so we are using the tail to pacification of the Vayu. As per their Prakriti, we are using the oil. As per their Prakriti, we are using the medicine. We are using the Nashyam therapy also for each and every participants. When we are discussing about the integration, suppose in naturopathy, hip bath is very important. It works as a thermoregulation. It's very good for the bladder also, for the diabetes also. So when we are giving the hip bath, so in naturopathy, there we are using normal neutral water. But when we are doing the integration, we have the Dashamula Kwatha. Dasmul means there's a 10 types of root which pacifies the vata, which reduces the pain, which reduces the stiffness. So in the same hip bath, we are using Dasmul Kwatha when participants take the hip bath. And during the hip bath, we ask the participants do the Ashwin Mudra. When they are having the poor bladder control or motion control. So in physiotherapy, in yoga therapy also, we are focused on the pelvic floor muscle strengthening practices. So we are giving them Pawan Muktasana, butterfly stretch, all the practices. But everything for what? For the control on the sphincter. So in the yogic text, specific practices they are having to please do the Ashwini Mudra, contraction and relaxation of the anal sphincter. When they are doing this practice in the hip bath, so that is the yogic practice yoga, Ashwini Mudra, naturopathy is the hip bath, and what medicine you are using, that is from the Ayurveda. So this is the integration of yoga, Ayurveda and naturopathy for each and every individual. Sometimes this mud bath also is pain relieving. So when we are using the mud, we are using the hot mud. We are using the Panchavalkal Kwath Churna, Panchvalkal Kashaya, we mix with the mud, and that mud is hot, like we are using the wax therapy in the physiotherapy. Same kind of wax therapy we are applying here for the participants, which is very helpful to reducing their stiffness, pain, and rigidity. In the same way, massage therapy. When we are giving the massage to the participants, we told them, please feel the movement of the hand. This is very important. When whatever the movement we are doing, if you will feel, because brain, breath, body coordination, we are telling them, explaining them in the layman language. Why there is a no movement? Joint is good, but joint is dependent on the muscle. And muscle is also good, but muscle is dependent on the nervous system brain. So this is the root, this is the fruit. So this is the branches. So whatever treatment we are doing here, you have to feel from here. You bring your mind here. If you will feel it, then there will be a synchronization between brain, breath, body coordination. You will get the better result. So our main aim and objective of this therapy, how we are getting the good result, where we are able to convince the participant, explain the participants, and give the concept of our holistic system of management, Ayurveda, yoga, and naturopathy. There we are getting the very good improvement. I will share one example. One participant, he was not improving. Why? Because in somewhere in his mind, he had that thoughts. His father had the same problem and he died due to the stroke after 3 years, but he could not improve. And that time he put his all the efforts, all the pathies. Then here next week he met then other participants. Then participants was improving. Actually that participant was here, he went to home for the 2 week. Again he come back, then he spoke to him, he gave him confidence. No, you see, I am fine, I am improving a lot, all this improvement because of this place only. Then this participant asked, how you came to know about this place? Because he's very intellectual who is not improving. And he told, no, one of my friend told he improved from here, so I came here, I am also improving. He got the confidence, but again in his mind there was a conflict. My father has not improved. Then that participants told him, sometimes here I have seen so many people has not improved also. Then another participants, why they have not improved? In their discussion he told, because most of the people who is on the tamas group, who is on the ischemic group, who is having the kapha prakriti, they are more resistance to the physical activity. They are not involved in more physical activity. They are not putting much effort on the physical activity. That patient told him, if you will do, if you put your all the efforts, 100% you will be all right. So after that, confidence means sometime one patient, one participant, he is teaching to the another participants. So when we are having the rehabilitation setup, residential rehabilitation setup, when they are in the group, so in their discussion, the participants are improving very well. So our Dean, Dr. Nagratna, emphasized always, please don't go to the patient's physical health. We need the symptoms. We are going through the symptomatic treatment, but these all these symptoms are branches. What is the root? Root is very important. Their psychology, their psychological health, their emotions, and same thing. Yogic text also in the Mahasi Patanjali has mentioned yoga chitta vritti nirodha. In the one line, the yoga is only mastery over the emotion, emotion, emotion. So our main aim and objective, this motion, this physical movement, this asana also is a motion by which we are going to touch the emotion. And through the devotion also, we are working on the emotions, find the solution, and start the revolution in the system is a concept of yoga therapy. Thank you,
Lovely.
Dr.
Dr. Amit Singh, what a wonderful deliberation. Uh, Very uniquely, you have brought out how different systems of medicine, you know, the naturopathy concepts where there is a concept of using cold water or lukewarm water. There, if you make the water hot and add some Ayurveda herbs with it, then it becomes more potent. And then integrating that with different postures of yoga, breathing techniques, with mindfulness and connection of the body, breath, and mind. That is a kind of a amazing yogic lifestyle, which definitely should be able to produce a lot of impact at all the levels in the rehabilitation of patients suffering from chronic neurological illnesses. So we have been having an amazing discussion, very fruitful. We are towards the last 15 minutes of our discussion. Before I take concluding remarks from all the speakers, let us go and see whether our viewers, are there any questions from our viewers? There is a question on, can you suggest any yoga for facial paralysis? So I would like to take feedback of Dr. Amit and then Christine on this question. First, I would like to ask Dr. Amit Singh.
Yeah, we have the yoga module, integrated approach of yoga therapy for facial paralysis. We have the voice culture. We have the Kapur Shakti Vikashaka, like this. We have this Kapur Shakti Vikashaka with the neck movement. We have the specific yoga module for the facial paralysis in the yogic text. And the same time, we have in the Ayurveda also, where we are getting the very good result. We are doing the Nasyam with the Karpasyadi Tailam. We are doing the Nasyam After the facial massage, give the steam, then put the 6 drop of this specific medicated oil, or we are using Chirbalaghitam for this. And we have the calotropis. Calotropis is the in Sanskrit name is the madar, English name is the calotropis. The leaf of calotropis with the Chirbalatelam. Just we have to heat this calotropis leaf with the Chirbalatelam and do the reverse massage. Suppose if it facial paralysis, if it tilt this side, so we have to do the reverse massage from here. That is the very helpful for the facial paralysis. And Brahmari pranayama. Close the ears and do the Brahmari pranayama. Feel the vibration of the Brahmari pranayama. It's very essential for this. So we have this specific pranayama is Brahmari pranayama, Kapol Sakti Vikaska to strengthen this facial muscles, and using the Nashyam and this calotropis leaf for the facial massage.
Okay, so Dr. Amit Singh emphasized the value of doing pranayama techniques and also the Nasyam treatment, that is the nasal instillation of a lukewarm oil in the management of facial paralysis. Christine, your views?
Yeah, I've worked with a few people with facial paralysis and also with trigeminal nerve pain. And, you know, I have a very, let me say, I feel like it's important to be very subtle and gentle, because especially with trigeminal pain. But with facial paralysis, one of the things that I like to use a lot is to visualize the movement happening. So, and then when you stimulate the one side of the face, you know, it's going to be stimulating there's a response on the other side neurologically. So I use a lot of visualization with people and let them do it while they're in Shavasana, and make sure there's no shame, you know, because that's a big problem, especially for women, to feel like they can't, you know, the face is so important. And so to make sure that they don't feel shame, they can lie on their back while they do the practices, and they can visualize that there's something that's shifting. I think that can be very helpful. I also like to do visualization for Nadi Shodhana, because Nadi Shodhana is so balancing for the brain. And so you don't necessarily have to use the hands, and sometimes using the fingers even, there's potential that it can be dangerous because of the effect in the olfactory bulb and the epithelial cells that go into the nose brain. So sometimes just imagining the breath gently moving in and gently moving out, and then some work with self-acceptance and self-compassion, because it is a scary thing for people, or a shameful thing sometimes for people. So lots of self-acceptance and self-compassion, I think, is very important as well.
Very important points have been brought out by Christine. So the role of imaginary techniques, and also not to feel ashamed. This is to try to live the life normally is a very important aspect. Dr. Padmini, there is a question from one of the viewers. I am suffering with tremors in my legs. I stumble and fall. My age is 23. Am I getting stroke? My CT scan is normal. Please help.
Thank you for that question. It's a very sweeping question. You can have tremors from so many reasons. I'd hate to speculate long distance like this and try to give you particular advice, but I'm sure I'll just talk in general, and maybe that'll help you. Tremors can be due to various reasons. You know, when you're nervous, you have tremors. Just means there's an excessive sympathetic activity in your system. There are conditions called benign essential tremor, which is a very common problem in the population, and it runs in families many times. And it can be very easily fixed with a small amount of medication, or just just being aware that it's not a dangerous illness itself will relieve you. So I think it's important for you to consult a competent neurologist who can actually evaluate you and give you a proper advice. It'll be it'll be ill-informed to give you some advice based on just this one line and then pretend that I have given you some help. It's important to recognize the process. It takes a lot of good history taking, evaluation, and follow up to really identify what the cause of tremors is. So I would encourage you to go to a competent person who can take the time to talk to you. And this is another thing that I think people blame all the allopaths, you know, in one sweep. There are good allopaths and not so good allopaths. Some of us listen, some of us spend the time. And one of my teachers used to tell us the biggest treatment that you can do, the best treatment that you can do is sometimes just a 6-month follow-up. So intervention is not necessarily the only way to go, is what I'm trying to do. So recognize that there are ways, if you and your physician collaborate with the understanding that both of you are interested in you getting better. And this is a common situation. There is so much bad publicity about bad doctors and bad patients that it is difficult, especially since I practiced in California. My first impression when I first went to California was there's a lawyer in tow with the patient, figuring out whether I asked the question with the right tone of voice or not. So yes, there are lots of lawyers. I'm not saying all lawyers are bad. They are needed, but at the same time, there is a tendency to over protect yourself. And my experience in the 40 plus years of practice that I did in the West is if you're honest with the patients really love you. Not knowing something is not a sin. There are many things I don't know, and I feel very comfortable. One of my teachers, when I graduated from medical school, told me, if you can say I don't know and know where to send your patients, I think I've done my job.
Wonderful. Very insightful, Dr. Padmini. And I think this answer will surely help the person from the audience. There is another question. My father is slurring after a minor stroke. We started on mantra japa and it has helped a little. Can you please tell more yoga? I would like to direct this question to Dr. Amit Singh.
Yes, definitely we have the module for this. There is one module, it's called as voice culture, where we are having the tongue massage, tongue rotation, and we have the one specific churna, vacha churna. This vacha churna is kind of brain tonic, midhirashan, which works on the nervous system. We have to do the massage with this vacha churna on the tongue, do the tongue movement, rotation, tongue in and out with the relaxation method. There we are getting very good result in this. Another one medication we have in the Ayurveda along with this yoga, Akar Karab Swarasha. So the Swarasha, the extract of that medication, we have to keep into the sublingual 4 drop twice a day for the 4 days. He will get the best result in this scenario. And along with that, other practices, because whenever we are talking about the any element, so there is a one thing where we have the symptoms. So always symptom is here, that is the branches or fruit. But along with this specific practices, definitely he should do the pranayama, he should do the meditation, and he should work on the emotions and at the manomaya kosha level, at the level of root. So it will be very helpful in this condition. And if they want, we can share this module also with the conference team, and after that they can share to the audience.
Very aptly answered, Dr. Amit. I think the person who has asked this question will really feel benefited. And from your clinical experience, you have observed the benefits. So I would request them to get in touch with the team. One last question that we have is, can yoga therapy conquer over the pharmaceutical kingdom as a best alternative treatment method to this disease? Oh my. So, Christine, would you like to answer this question?
Yes. I think there's a lot of money in pharmaceuticals. I'm not an expert on the pharmaceutical kingdom, and there's a lot of money in it. India is a big producer of pharmaceuticals. America is a big consumer of pharmaceuticals. It's a big problem for sure. But we all have to fight for the dharma and move forward. Of course, medicines help people, but from my perspective, somebody who works a lot in mental health, many of the medications that were developed to help people, for example, overcome depression, have become first line treatments, and they were supposed to only work until you got the cognitive therapy to work, so it's a huge problem, I think, in all aspects of the medical world, but I think that yoga therapy has a lot to offer, and let's get it out there and let's help people to understand that they have some things that they can do besides just the pills.
Thank you very much. It was such an enlightening session, and I got to learn a lot from all of you. I really thank IM for organizing such a wonderful event and calling such enlightened speakers. Before we conclude, I would like to have a very brief message from all of you. The message should be directed actually towards the patient who have stroke. And what is your advice for a person who or the caregivers of such people who are suffering from chronic neurological disorders? I would like to begin with Dr. Padmini.
I'm a great believer in goal setting. Some goals are realistic, some goals are unrealistic. And we need to take one step at a time. Of course, the fact that there is neuronal plasticity gives us hope that there can be continued improvement. But if you start to expect that things are going to change overnight just because you have a great goal, that will set you back. So I think it's important to be realistic, and it's important to understand that anxiety and depression are part of the recovery process. Allow yourself, cut yourself some slack, understand that this will be part of your journey, and find ways that help. It can be just listening to good music for some. It can be taking a pill. I won't throw the baby with the bathwater, Christine. I think there are useful, avenues in which medications help. Are we over medicating? Sure, we are. Some of us are anyway. And so that doesn't mean that they don't have a role. Is there a profit motive in pharmaceutical industry? I'm sure there is. Nobody's going to do this kind of research for free. So I think we need to factor that in our thinking and not, I don't want to use the word bad now, but not polarize, because then by subscribing to one or the other view, you're taking people who need the help away from the source of it. So I think it's really important to understand that. The other important thing that I think is very important is to give them hope that they can be productive even as they are recovering. Simple things like, let's say you have a problem with your speech, your hands and legs are working, you could be doing something with your hands and legs. That gives you a sense of productivity, and that itself will make a big change. Just to give you an example, I used to have a lot of old patients with depression. And I just decided that this is not right. So I just told them, next door to my office was a hospital where Christine will relate to it. There are all these pink ladies who go and help the patients in the hospital. Pink ladies are all mainly volunteers, and it's amazing. I still remember the patient that came to me really looking sad and drawn and really miserable. I just said, I have a prescription for you. Go become a pink lady. And you would be amazed in 4 weeks' time, she came back and thanked me so profusely. She said, "This is the best medicine you have given me," because she
Right.
realized that her situation is not unique, and that being of service to anybody else itself is a booster of your emotion. The other thing that is important is to understand that we should be helpful by being part of a support group if we have benefited from the treatment by sharing, or we could go to a support group where somebody else who has benefited can share. Because at the end of the day, you and I, we're all in the treatment realm. We will never understand what they are going through. It's easy for us to say, yes, I empathize. Not true. So they need to be with people in a similar situation to understand how best to help each other. I think that is a crucial message that everybody should take home.
Thank
Thank you.
you, Dr. Padmini. Christine,
I know we're just about out of time, and thank you, Dr. Padmini, because that was so beautiful. And I'm so glad you mentioned Seva because it's such an important part of the yoga system, and my husband and I work together a lot. He's a psychotherapist, and we always talk about this concept that Seva is so important. The only thing I would add is the way to build a good habit of self-care is to hook it into other self-care habits that you already have. So, make sure that you give yourself 10 or 15 minutes where you're going to do some meditation, some asana, some pranayama every day. You make that part of your lifestyles. And if you can do it in the morning, great. If you can do it in the morning and the evening, even better. But to make sure that you are committed to having this healthy habits and continue, and that you have support from the people who you live with who are really encouraging you to do these healthy habits as well. I think that this is a very important part of self-care.
Dr. Amit, your message to patients.
You should follow the 3P model. You should have the patience, preference, and practice. Infinite patience. You should not be impatient. No, I'm not improving, not improving. Preference. You should fight, fight, fight. Follow and practice. Every day, practice is must. So day by day, they will get the improvement. Sometimes they are doing the practice with a lot of enthusiasm for the 10 days, 15 days. After that, when the patients they are not getting the improvement that much, what expectation they have. But Dr. Padmi told about the goal. So after that, they are thinking, no, there is no much improvement. I will be like this because they are having that mindset. Somewhere it's deep in their psychology. No, I will not improve. I will not improve because they have seen several cases like this. So we should give enthusiasm to them. Every day they should practice 100%. They will get the result because it's time taking treatment.
Thank you very much. And I personally feel that the kind of discussion that we have had, definitely it should not end here, and we should all come up with some idea where the mind-body approaches and their role in the role of integrative medicine and mind-body approaches in neuro rehab should be brought forth. So, with guidance from IM, probably we all can think of writing a letter to editor or a concept paper to some good journal, so that as a proceeding of this conference also this outcome comes out and leads a way forward towards changes in the policy making. Thank you once again, all these speakers. It was such a delight to interact with you and learn from you. Now, I hand over the session again to Shri.
Thank you so much, Dr. Bhargav. What an informative webinar today. Dr. Padminiji, it was a wonderful to learn about how we can regulate and develop a healthy mind and bring awareness to ourselves in order to keep us healthy. Miss Weber, it was great to hear from you. I think that the way you described a specific way to do inhalation and exhalation, which you call square breathing, is a great way to remember type of pranayam. I also loved your wonderful analogy of the chariot and the horses and how they relate to the Panch Indriyas. Dr. Amitji, it is so interesting to understand how emotions can change our health and how we can take care of our health by just making changes in our awareness and emotions. It was great to learn all different aspects. Um, it was so informative to listen to you about the three doshas, Vata, Pitta, and Kapha. I think we all really learned a lot today. Thank you, Dr. Bhargav, for moderating such an impactful conversation. You perfectly tied the topics of Dr. Padmini, Miss Weber, and Dr. Amit. I would also like to thank our tech team today, Chaitanyaji and Saurabhji, without whom this webinar wouldn't have been possible. Thank you, Dr. Amit, Dr. Padmini, and Ms. Weber for enlightening us with your precious information and knowledge. As for our viewers, we thank you for attending the webinar, and I really hope you enjoyed it and learned a lot today. For more informative webinars and workshops that are being hosted throughout the month of June, please visit our website. Our next webinar is on meditation as a psychosocial intervention, and it is starting in 10 to 15 minutes. Thank you so much for coming once again, and I hope to see you all very soon. Namaste.